Hello and welcome back to my channel. If this is your first time here, I'm Nurse Alyssa, and today we're going to be going over Tegaderm Hydrocolloid Thin. But first, if you could hit that subscribe button, it would be greatly appreciated as it truly does help my channel. So let's get started. So Tegaderm Hydrocolloid Thin is a thin hydrocolloid adhesive with an outer clear impermeable adhesive cover film. So indications for use. So we're going to be using this on shallow healing wounds with small amounts of exudate. So this dressing, it can't absorb exudate. So we got to make sure that it is very small amounts of exudate that is coming out of these wounds. Now, precautions, we're not going to be using this on an untreated clinically infected wound. For contraindications, we're not going to be using this on wounds with moderate to large amounts of exudate. And once again, do not use this on clinically infected wounds. So first we're going to start by cleansing the wound with some normal saline and drying the peri wound, okay? Making sure that it is dry. You can apply a skin sealant to the peri wound if needed. And then you're going to choose an appropriate size. So we want to make sure that it goes beyond the wound edges on all sides by 2.5 centimeters. So it extends past the wound edges 2.5 centimeters. Once you have chosen the correct size, there is 2 flaps on the back, a larger flap and a smaller flap. So you're going to carefully remove the larger flap, put it on, and then while you're holding that, release the second flap from underneath and then smooth all the edges. So to remove, you're just going to lift up on the edges and pull away from the wound. Don't pull upwards, you want to pull away from the wound. Frequency of dressing change. So this is going to depend on the amount of exudate coming out of the wound. It can stay in place 5 to 7 days or until it reaches within 1 centimeter of the edge of the dressing. So the exudate, if it's reaching within 1 centimeter from the edge of the dressing, you want to change that. The expected outcome is that exudate is managed well with no peri-wound maceration. If you're getting macerated tissue, you need to go to a dressing that's a little bit more absorbent. So that's all I have for this video. I hope you did find it helpful for your daily practice, and I will catch you in my next video, guys. See ya.